My name is Dr. Rick Saguil.
And action. Hey, Jay had a... This is Kirk again. And action. Hey everyone. Vince had a question about stress fractures. Stress fractures are breaks in the bone that occur when you over stress a bone. Sometimes bones are meant to tolerate stress. Bones are meant to have us mobilize against gravity. But in some cases, when you overwhelm the amount of stress applied to the bone, or if the bone, like the fibula, I'll show you that in a second, which is meant to tolerate up and down stress, that's why it's long. When it has stress from the outside, like a tackle, or shoulder tackle from a lineman, or in the scrum, then it's not going to be able to tolerate that. It'll break easy, especially as you get older. But we'll talk about my top 5 things to speed up the resolution. But if this is the first time you're finding me, don't forget to hit the subscribe button and the notification bell to find out when I do new videos. So how do we take care of these things? Let's explain it first. Hopefully this is easy for you to see, but this is an x-ray of a tibia fibula, the foreleg, the shin. And the shin is made up of a big tibia, that's this big guy. That's the bone towards the inner side. So if you're looking at my legs, you can't see them here. The inner side of the shin is the big tibia, and this little tiny chicken wing on the outside, or bone on the outside, is called the fibula. This is the weight-bearing guy. This is your left, or the kid's left leg. This is the weight-bearing bone. This is just an accessory bone, fibula. But in Vin's case, the fibula is the thing that we're worried about. So in this case, you can see that there's, this is an x-ray obviously, you can see there's a little bit of thickening to this fibula here, if you can see it from the camera. If not, just bring up an image of tibia fibula. Typically this tiny bone is not that important, but it does attach, it makes the tibia stronger, and it does give stability to the ankle down below. But in most cases, if you see a black line going across, that's a complete fracture. And that's easy to tell. Usually a patient would be extremely painful right at the time of the injury. So it's self-evident. Sometimes a very severe sprain, and see my previous video on Dr. Rick Minute Clinic ankle sprain. A sprain will be so painful because it's a ligament tear that it'll mimic a bone fracture. So that's typically, if you see a black line through it and your doctor shows you the x-ray, that's a fracture. If it's a fibula, it's not bad. It'll still take, if you're 20 to say a 30-year-old, still take you about 4 to 6 weeks. If you're a 40 to a 50 or 60-year-old, it might take you twice that. If you're totally unhealthy, no matter what age, or obese, and smoke, and don't watch your diet, you can triple that. So be careful. And also, in the case of Vin, he's an athlete, so we might want to speed up the healing process, which is what we'll talk about. So if you don't have a black line going through the bone or the x-ray, and then I would worry about a stress fracture, especially if it's exquisitely tender. There's something I do in an office called a tuning fork test. If you can vibrate the bone with a tuning fork, which kind of depends on how thick the skin is, because if you put a tuning fork, the skin doesn't vibrate bone. If you put a tuning fork over thin skin and it gets to the fibula and you vibrate it at about 125 to 250 cycles per second, or frequency, then sometimes the fine vibrations applied to the bone, specifically to that area, and not to all the areas, but to that area, the vibrations will take a microscopic tear or break and vibrate them so it hurts. So a cheap trick that athletic trainers do is if you apply ultrasound over the soft area, just in facilitating the healing process, which ultrasound feels good, but it too uses heat, has a extra modality, heat, and sometimes you can do it in vibration with phonophoresis. It'll hurt the stress fracture, and that'll be a clear indication, whoa, this is a problem. So it's not just that it hurts the skin because it's swollen or black and blue, but bone doesn't like, when there's a shard in the bone, it doesn't like to be vibrated. So cheap trick would be tuning fork. Another trick, if you have an athletic trainer or physical therapist, would be applying ultrasound and seeing what happens. So Yes, whether it's a tuning fork and vibration or ultrasound, and ultrasound is vibration too, if it's positive, then I would say treat it like a stress fracture, even if the doctor said it's okay on the x-ray, because these x-rays, sometimes because bone is a little bit slow in showing its, revealing its problem, if it's not a crack that you see on the first x-ray, if you're still in pain, I would either in 2 weeks repeat another x-ray to see if it then shows your crack, or you go to a bone scan. I don't have a picture of a bone scan. That's when you inject a radionuclide dye into white blood cells. It tags white blood cells, and white blood cells like to go to areas of repair. And you'll see on a nuclear bone scan, and it's not that much radiation, so it's not that bad, but it gives you good information. You'll see a black spot on the bone scan, and that'll indicate stress fracture. So whether it's a fracture to a fibula or a stretch fracture to a fibula, there's a couple things I'd like you to consider, no matter how healthy you are. First thing would be to maximize on vitamin D. So vitamin D, you'd figure if it's summertime, most of us will have enough, but it's not enough. You have to be exposing about 70% of your body between the hours of 10 and 2 if you're living on the equator. And a lot of us don't do that. So, and then there's a question about if you have dark skin, African American, if you actually get the stimulation of body making vitamin D in the skin, which it can do. But just go ahead and take vitamin D. So I usually like vitamin D3, not vitamin D2. Vitamin D3 at 5,000 international units a day. And you're supposed to take it with fat or food. So good quality. I don't think you have to worry about any adulterants, so go cheap. You don't have to go good quality. The next would be vitamin K2. So most of us know vitamin K. I think Special K, the breakfast cereal, was made somehow like that. Vitamin K, if you're on a blood thinner, you got to be careful with. Vitamin K2, I still say you have to be careful if you're on a blood thinner, but in Vin's case, he's not. But K2 makes the D3 get into bone faster. So I like to remember 50 micrograms. There's different measurements and dosages depending on which brand you get. But if you can get approximately 5,000 of D3 and 50 micrograms of K2, I think that's decent enough every single day. Both of them can actually, there's formulas that have both of them together. And again, I don't think there's that many bad adulterants. K2 is a little bit different because some fly-by-night companies will say it's K2 and it's not really K2. So that there's not too many adulterants in that, but the quality might suffer. So I get a higher end depending on where you live. The other thing is turmeric extract. So check out my video on turmeric that I've done. I don't think that the powder or the actual turmeric root, I don't think we can tolerate that much. So I think the extract that's what exactly it means. The extract from the root, the active ingredient in concentrated form. So please, I follow Consumer Labs and I like Doctor's Best High Absorption Curcumin. Curcumin is the active ingredient of turmeric. So I'll put a link down below for the video I did on unboxing turmeric. And do that 2 to 3 times a day. The only problem with turmeric is, especially if you take the powder, you might get constipated. It's very drying. In India, it's a drying herb, but it's a great anti-inflammatory. I have a lot of Indian patients that'll also not only increase the amount that they take in their food, which I think that you have to have high doses, and you'll see it in my video, but they also apply it to their skin, which is cool. And since we're getting to skin, I think an acupuncturist, a Chinese-trained acupuncturist would be important. So we have, in the United States, we have acupuncturists that have been certified, and some of them are chiropractors, which is fine. Some of them are MDs, which, like me, is fine. I think I can compete with my chiropractic friends. I think I'm pretty good with finding, just because of my martial arts training and my yoga training, I know pathways, meridians or nadis and chakras. I'm very good with that, so I can find the right place to put the needle. You can't just have somebody put a bunch of needles in and hope that it helps. But sometimes you can get physical therapists to also use dry needling. Dry needling is not exactly the same concept as acupuncture. Dry needling works more towards increase or decreasing spasm to muscle, which will help. if you can't find anybody else, it will help with regards to decreasing pain. And when you decrease pain, you decrease inflammation. When you decrease inflammation, you have faster healing. So I like Chinese trained. So check out where you can get Chinese trained doctor and check out their credentials. They don't have to be Chinese, but if they went to Beijing or went to a Oriental school, awesome. So usually needling has to be 2 to 3 times a week for a couple weeks to speed up the healing process. And again, in Vince's case, being 20 to 30, you should do fine because of the amount of testosterone that's going on. Testosterone will build bone and build muscle, build bone, should turn around. But that leads me to number 5. You really, even if I've always said my young guys don't have to worry about protein as much versus older guys like me, I think we maximize on protein. My 20-year-olds, I used to say, don't worry about it. I think because of the high testosterone level or estrogen, if you're a female, that you will be fine. And females even have high testosterone too, relative to older females, but that helps with healing. However, in this case, I would say that you should pay attention to your food. So if you're an athlete, you really shouldn't be eating crap, number 1. Number 2, probably should be stopping dairy for the short time. If you're not a vegan, I'd hold off on dairy because there's a lot of dairy substitutes. I just think dairy, depending on the cows that the farmer took care of and how he took care of the cows, there could be some other issues with dairy, and some of us have an allergy to the casein protein. So I just avoid dairy because there's so many other options. And again, you can get vitamin D and K2 outside of dairy. A lot of my patients will say, well, I don't get any calcium with if I don't take dairy, and that's bullshit. If you can actually increase your green leaf, dark leafy green vegetables, I think vegetables carry a lot of calcium. And they also carry vitamin K, not K2, K1. So hopefully I'm not getting you confused here, but so try to avoid the dairy for at least a month, and you'll probably see if you have acne or issues with your gut, you'll probably see that you'll be less flatulent and have better skin. So why not? The other thing is, the question would be if you're a vegetarian, or if you're not a vegetarian, can you still take egg, which is poultry, and meat? Yes, go for it, because the protein that you need to heal up, and that's what I was getting at with my 20 to 30-year-olds, I would now pay attention to protein. So you can do the old calculation of 1.2 grams per kilo per day of protein. I think I've done a video on protein, so I'll find the link and I'll put it down below to make this a little short. And please watch my video on protein. Leucine is really important, but I would really maximize on your food. Bottom line, maximize on your food to speed up the healing process. So the whole objective is to compress the time frame of healing so that you get back to exercise. And very important, where did I put it? Do no further harm. Do no further harm, because as an athlete, a benched athlete can go through depression. A weekend warrior athlete that doesn't get to exercise, that's not fun. So you can do non-ballistic. I did have a very good runner back in the 90s who I saw, and I treated a stress fracture, or medial tibial stress syndrome, shin splints it's called. And I took care of her. I gave her anti-inflammatories back then. I didn't know too much about herbs. I sent her to a physical therapist to cross-train. And lo and behold, the physical therapist was doing, that was with, I can't remember the name of the physical therapy group back then, but the physical therapist was having her do wind sprints. And I'm thinking, why on earth would the physical therapist go against my orders? And of course, she went from she went from shin splints to a diagnosed stress fracture. And I didn't bother with a bone scan, so she blamed it on me, when in actuality, I said no running. But suffice it to say, do no further damage. No impact, no ballistics, no plyometrics. You can do upper body as much as you want. Perhaps concentrated and isometric or very slow movements to squat, but no impact. Because if you just have a little bit of inflammation and you add more impact, you will go to a complete fracture. So that bone in 2 weeks, the x-ray in 2 weeks will show a complete fracture. So just work out upper body and cross train. Water is an excellent way to work the thighs and work the calves without putting too much stress on the bone, but Nobody likes water. Also, the other thing is don't take any H2 blockers. H2 blockers are Pepcid, Tagamet, Zantac. If you have reflux or acid, because they block the absorption of these guys here. Same thing with PPIs, so omeprazole, Prilosec, Axid, Pantoprazole, all those acid blockers that we use for reflux, they decrease acid. When you decrease acid, you can't really absorb these vitamins properly. I also say no alcohol. So no alcohol, sorry, that's a pro-inflammatory. It makes you feel good. I'd rather have you do CBD. I was going to put CBD here, but in general, I don't know the laws in the area of where you are. I know in Illinois, medical cannabis is legal, so I would get my card for medical cannabis, get to a dispensary, and try to find the highest dose of CBD and do it 2 to 3 times a day. It should not get you high. It should just help with calm a little bit, and it definitely should help with inflammation. But that's another video. And then there's importance with sleep, because when repairing, all of us get by with little sleep, and that's fine. But when you're in injury or on the bench, as far as your exercise, you really have to maximize on your sleep. You might not think your brain needs it, or if you're anxious, you're going to think that's too much sleep, but really it's important to get decent sleep, wake up refreshed, not take any naps during the day. I think this is the repair time. It has to do with the gut. The gut starts to send out the little repair guys, the repair bots, to repair faster overnight, also take care of the brain. And when we shortcut that, you can get by, but since we're injured, try to maximize 8 hours of sleep. And there's this thing called strontium. In Europe, in the EU, Europe did some studies on strontium, high dose. They came up with some kind of prescription, and they found it did help modestly with bone fractures, osteoporotic fractures. But a longer study showed that it also caused or was associated with, I think it was heart disease. So if you have a heart issue and you're older, don't bother with that. And again, this question or this minute clinic is towards Vince, who is in his late 20s. And so with regards to strontium, I don't think it'll hurt, but I would do it at vitamin doses. So anything less than 100. So if you can add strontium, that's up to you. But we're already doing vitamin D, K2, and a couple other things. So strontium might be an extra pull on the finances. Just keep it easy. So that is what I would do with regards to injury. Physical therapy will help. Topical is always helpful. It decreases the pain. But if you decrease the pain, sometimes the caution is you're going to feel better, so you might test out the bone. I would not start doing impact until you're cleared by a physical therapist or orthopedic surgeon or sports medicine doctor like me. Be very, very patient, cross-train, and have the calendar out, because if you are watching this and you're an older athlete, 30s, 40s, 50s, I should say 50s, 40s, 50s, and 60s. So 20 to 30 is not old. But if you're an older athlete, you might take longer to heal up depending on how many medical problems you have and how many prescription medicines you take. So just go see your doctor. This is never an answer that my non-patients get through, but it's only for my patients. If you are not my patient, take this video or the information I did give you and then bring it to your doctor and see what he says. So hopefully this gives you, Vin, a little bit of information on what to do. If you have any, if anybody else is watching and has any other suggestions on what they've done for stress fractures or medial tibial stress syndrome, shin splints, please put them down below. Otherwise, don't forget to subscribe and hit the notification bell. I'll see you in the next clinic.